So now my question is, if somebody is having a spinal cord impact, do you have a region that carries the sympathetic and parasympathetic? Oftentimes when you have a patient with MS, they end up having some problem with their bladder and their bowels, right? What happens to them? Why does that happen? They always say, oh, I'm urinary incontinent, I got a Foley catheter for life, oh, I'm retaining urine and I'm Foley catheter for life, right? Why does that happen? Let me ask you this question. So now my question is, if somebody is having a spinal cord impact, do you have a region that carries the sympathetic and parasympathetic? Yes. This area here is responsible for your sympathetic fibers as well as parasympathetic, depending on the area where you are. If I'm thoracic and I knock this part off, I'm taking out my sympathetic. But if I have a lesion in my sacral, in this area, I'm taking out my parasympathetic. That's the difference. So whenever you think of parasympathetic, what does it do to your bladder? Is it supposed to cause you to pee? Parasympathetic starts with letter P. So it makes you pee. Okay? So parasympathetic, if it is going to get affected, then you cannot pee. And therefore you're going to retain urine. So let's put parasympathetic needs to make you pee. What about sympathetic? It makes you stop peeing normally, right? It makes you stop peeing normally. So you would expect the opposite, right? If somebody's got a parasympathetic, you're supposed to pee, but you can't pee, so you'll retain. If you have a sympathetic lesion, which is supposed to normally stop you from peeing, is now going to have you to have overflow and urinary incontinence. Similarly, you have the impact on your bowels. You can either have constipation or you can have diarrhea because your rectum cannot hold poop. Okay? So you can go either way when it comes to your patients with MS.